Thank you so much, everybody, for joining us this afternoon or this morning, depending on where you are. I'm Jessica Solomon Fisher, one of the vice presidents at the Public Health Accreditation Board. I'm pleased to serve as your moderator this afternoon for our webinar, Top 10 Things to Know About Service Sharing. Just a few logistics to get us started. You'll note that you have the ability to chat in questions. Please do that at any time. We are going to have a Q&A at the end of the presentation. We will also have an optional 30-minute session that follows the webinar. That's really just if you want to talk further, a little bit of technical assistance and kind of dive in to some deeper conversation. So near the end of the webinar, we'll drop another Zoom link in the chat box. And then when the webinar concludes, we will log out and log back into that Zoom for those who want to join and engage in a hopefully rich conversation about service sharing, answer any questions you may have from our subject matter experts on the line. And we're really looking forward to that. So without further ado, let me go ahead and turn it over to our speakers this afternoon. Thank you so much.
Great, thank you, Jessica, and hello, everybody. Glad folks could join us today to learn about the top 10 things that you should know about shared services. By way of brief introduction, my name is Grace Gorenflow, and I am the director now of the Center for Sharing Public Health Services at PHAB. And my work now is focused mainly on providing technical assistance to different sites across the country. You will see as we move through the webinar that we have many resources that we've developed over the years that we have to share, and we are working hard at helping people use those. I'm going to turn it now to Travis to introduce himself.
Thanks, Grace, and thanks, Jessica, for kicking us off. I am Travis Parker-Lee. I'm a senior specialist with the Public Health National Center for Innovations at PHAB. Folks don't know who I am. I used to work at PHAB on the program accreditation side, and now I work in our innovation division, doing a bunch of cool things like working with Grace at the center and on shared services, and really kind of being that liaison and bridging the gap between folks that are connected through our 21C work and transformation work with the activities of the center and sharing services and resources. So I've worked with Grace for a very long time. Glad to be more official as employees and coworkers instead of just colleagues. So I'm glad she's on board. I'm glad that the center is part of PHAB now.
Okay, so you can see today that we have several objectives for our time together. The first is that as we go through our top 10 list, we'll be sharing with you key strategies that we have learned and seen in action that lead to, can very much help leading to successful service sharing arrangements. We are also going to share with you examples of how sharing initiatives can position health departments to achieve some various accreditation standards and measures, and also how sharing arrangements can support statewide efforts to transform their public health systems. And then finally, along the way, we're also going to be identifying resources and various examples to help you with your sharing efforts.
So to get us started on kind of grounding the presentation today and making sure we're all on the same page with our understanding of what is service sharing, this is how we defined it. It's when organizations share resources across their respective boundaries to be more effectively and efficient in their delivery of public health services, and really to help solve problems that cannot easily be solved by a single organization or jurisdiction. Before we move on to the next slide, I think Grace has a prompting question for everyone in the chat.
Yes, my question for everybody is to please use the chat box and let us know about some of the problems that you're facing that are not easy to solve by yourself. If you could take a moment and do that. And also, while you're doing that, these slides will be available And the slides, when they're posted, you will see that they have hyperlinks in them to facilitate your using the resources that we're going to be covering.
And as folks are answering in the chat, if you want to toggle to the two to make sure everyone can see it, that would be great. But also, if it's just up to hosts and panelists, we can filter that way as well.
Looks like people are feeling a little shy. Thank you to Elizabeth Ferreira for noting that it can be challenging to share regional services in an equitable way. We've certainly heard that before. Great. Getting support to meet community health improvement plan objectives. Challenges of meeting all the shared services, the essential public health services. All right, great. Next slide, please, Travis. So when we've asked this question of health departments in the past, these are some of the answers that we've seen, that we hear about the most. And just going back to the definition that Travis shared for sharing services, as you know, there are a tremendous benefit of service sharing is that you can achieve more together than you can on your own. And so, and yet we also know that collaboration can be very difficult. So our work has really focused on how to do this in a way that truly is mutually beneficial to everyone who's involved.
Well, I'm happy to kick off our top 10 list. So Grace just reminded me that some folks have actually not heard of David Letterman's top 10 list, which I think is crazy since I grew up with that. But we kind of want to emulate his style a little bit with no sound effects, unfortunately. But kicking off our top 10 list with kind of a celebration of sorts. 10 years of experience with shared service efforts. This is actually the 10th anniversary of the Center for Sharing Public Health Services. If folks are not remembering their history correctly, the center was initially established and run by the Kansas Health Institute under the leadership of Gianfranco Pizzino and Pat Libby, who I actually think are on today. I think I saw their names earlier. So welcome you two. It's been a while since we've chatted. Glad you could join us today. And then it did move to PHAB earlier this summer. So just a little bit of background, of course, has been supported by the Robert Johnson Foundation since its inception. And the center does provide grants, both large and small, or has provided grants to 53 different sites. They are mostly local health departments, but there have been some state and tribal health departments as well that have participated in those grant opportunities. And as a learning organization, the center provides technical assistance to and learns from its grantees, as well as a host of other health departments that are working on sharing services, either informally or more formally. The center has developed several resources based on this experience with health departments, and we'll be sharing some of those during today's webinar that Grace mentioned. And we also have collected various templates and examples of service sharing in action.
Great. So number 9, what you should know about sharing services is that the aim really should be about optimizing available resources. And Liska's comment in the chat box, I think, is really timely in terms of sometimes the policymakers not being on the same page as health departments when it comes to seeing the value of sharing services. And the reason I say that is that a typical struggle that we see is that elected officials might be most interested in this if they can save money. And on the other hand, public health leaders are more likely or very likely to think about sharing services if there's a need to be filled, if there's an issue in terms of the availability of programs or the quality of programs, something like that. And so our message to you is the importance of balancing efficiency and effectiveness. The overall goal is to enhance the existing services or add new ones, and maximizing the value of each dollar that's invested. So basically, when we think about sharing services and this balance, it's a matter of getting the biggest bang for the buck. And I've got a few examples of how this has been done in various ways, how the value has been increased. Value has been increased through sharing services. So the first example I will share is 2 health departments that shared an executive team, the director, the deputy director, nursing director, and environmental health director. So clearly, yes, there were cost savings involved because of the salaries. The other thing, though, is that this meant that all of their positions stayed full and were occupied in a way that they hadn't been before. These 2 health departments were are in the rural part of Western New York, very rural area, and they competed with each other anytime they had a vacancy to fill. So it was really, really hard to maintain the level of workforce needed. So not only was it saving money, but more importantly, it was providing them with the leadership staff that they needed to be for the health departments to be as effective as possible. In another example, when a new sharing arrangement was developed, it allowed some staff to develop more expertise. So when it came to the nursing staff, instead of having a few staff members who were sort of jacks of all trade, it allowed them each to go more deeply into specific topic areas. And I think the most significant one was one of the nurses being able to become a lactation consultant, which really was a boost for their work recipients. Another example is the reach of programs. We saw in Colorado several very small health departments in the San Luis Valley who worked together and were able to secure chronic disease grants that they were not able to get on their own. But when they came together, they were able to get the grant as a group and then offer additional programming in their jurisdictions. And then finally, another example where there were cost efficiencies with health departments who shared several services, and some of them involved using vendors, and they were able to secure more favorable contract terms because of the economies of scale that were involved when they were combining their populations. So biggest bang for the buck. That's the goal here.
So for number 8, this image should be familiar to folks if they've engaged with us at some point. But for those that this may be new to them, or if you need a refresher, as you can see that shared services can take several forms, whether that's a little more informal or looser integration of sharing services, to the more formalized aspects with that tighter integration as seen here on the spectrum. But really want to drive the point home that form follows function. So you might have heard about service sharing in the context of, and I'm sorry for these bad words, but regionalization or consolidation. But we really want to make the point that sharing services encompasses different points on the spectrum of sharing arrangements that might be present in your organization or jurisdiction. Again, these are the arrangements that are typically available, and we encourage folks that are thinking about sharing services to really use what makes sense for them and their organization. Again, we want that form to follow function and not for health departments to try and fit a mold that doesn't work for them. And there we'll have some links later on in the presentation to where you can find the spectrum more easily.
Great, thank you. All right, number 7. Factors that promote success. Through our work over the years with our grantees, we identified 7 ingredients, if you will, for success, and we divided them into 3 different categories, as you can see on the screen, and I'm going to briefly go through these. So the first one is to make sure that there is a shared understanding of the objectives of the sharing arrangement. We worked with a group that was several months into planning for shared services before it finally surfaced that their lack of progress, because it was really hard going for them, their lack of progress was due to the fact that each of them had a different understanding about precisely what it was that they were seeking to accomplish. So when they went back and had that conversation and negotiated their goal, after that, their work proceeded much more smoothly. So that's a very important step there. We also talk about a balanced approach, and it's not only a balance between effectiveness and efficiency, as we described a moment ago. It's also making sure that everybody wins, that every partner at the table sees an advantage to sharing. And we hear this can be an issue, particularly when there is a big discrepancy in the size of the populations. Smaller health departments that are served. Smaller health departments tend to be concerned that if they're sharing a service, they're really not going to have a voice, that they're sort of going to be swallowed up by the larger health department and maybe won't get the attention that they need, that their population needs. On the other hand, large health departments often have a fear of death by 1,000 cuts, a concern that if they agree to help out too much here and there with their smaller neighbors, that actually that ends up being a significant drain on their resources over time. So these are just a simplistic way of describing some of the sentiments that come into play when people are thinking about, well, is this going to be to my advantage or not? And it's really important that every health department does see an advantage, and that is a very clear and compelling advantage. And a good example that we have about this is with 2 health departments, a larger one and a smaller one, that decided to share services around communicable diseases, specifically to address a high rate of STDs. And what had been happening is that the larger health department that also had a metropolitan area was seeing a lot of cases of STDs and treating them, even though these people, a lot of the patients were coming from the neighboring, much smaller jurisdiction. And by working together, the smaller health department was able to more effectively reach the people who lived in their jurisdiction and take care of all of the communicable disease activities, not just testing and treating, but contact tracing and also prevention messaging and that kind of thing. So they worked on that together, and this lightened the load for the larger health department, which was really good, and it strengthened the infrastructure and the ability of the smaller health department. So that's a great example of mutual advantages. Trust is also here in the list in the first column. And I'm just now realizing I didn't say that everything that I just talked about, everything I just mentioned, including trust, these are prerequisites. We call these prerequisites because if these 3 ingredients are not present when you begin to work on a shared arrangement, you should really wait until the ingredients are there to proceed. We have also seen problems with sites that didn't have a decent level of trust, but Travis is going to talk about trust in a minute. But again, don't even start until these 3 things are strongly right there for your group. The middle column, these are facilitating factors. So if these things are present, leverage them. If they're not present, that's okay. You can still, move forward. But let's just talk about each of these for just a moment. The first you can see is success in prior collaborations. It's not unusual for health departments to already be doing things, at least on an informal basis, with some of their neighbors. And if that's not the case, there could be other parts of local government, other departments in local government that are working together. So it's really helpful to understand where health departments or other parts of their government have been successful and learn from those successes, understand why they were successful and leverage whatever was there or adapt your strategies accordingly. A sense of regional identity really helps in terms of health departments' willingness, and especially their elected officials' willingness to work together. The example I always give is from my hometown. I always tell people I'm from DC. And in fact, I've always lived in Northern Virginia when I lived in that area. But the District of Columbia and suburban Maryland and suburban Virginia have a strong identity as the DC area. And when you have that kind of an identity, it's much easier. People are pretty much in the mindset of we're all in it together. And so it's something you can't create, but if it's there, leverage that. And then finally, positive personal relationships. It's really important. So maybe the relationships don't exist. Okay. If the positive relationships are there, then that is a huge boost to your work. This is one where it would be really important to try to work on this, or if these relationships don't already exist. It's really helpful to take the time to break bread together. There's something about sharing meals that can really go a long way in terms of establishing relationship. And it's really important to remember that when it comes to sharing services, the work really is about partnerships as much as it is about relationships. So absolutely tend to those. And then finally, in the last column, what we have for our success factors are project characteristics. So these are things that really need to be baked into your planning and implementation in order to be successful. So the first, senior level support, that is pretty straightforward. I think strong project management skills is somewhat self-explanatory. What I will say about those is that it's important to understand that when you are setting up a shared service, it is a project. So it really does require somebody to be on top of having a timeline, being clear on respective roles and responsibilities, making sure that progress is being made. This is not something you can just sort of have on the side that people get to when they can. It really needs to be taken on as a full-blown project with all of the strategies that you need to have a successful project. Strong change management plans. This is about tending to the people side of change. Humans typically do not like change. Even if it's positive change and everyone agrees that it's positive change, it can still be threatening. And what we have seen is that, and I'm sure you all have seen this in your own work, if people don't understand what is happening and don't understand how they will be affected and how their job will be affected, in the absence of information, people will fill in the blanks. And usually they don't do it accurately. So it's really important to come up with a change management plan and incorporate change management strategies. And if you look on our website under our webinars, we have a webinar we did a few years ago on change management that could be really helpful. And then finally, effective communication. So it's not only about making sure that people who are involved with this understand what's going on. It's really important that partners and stakeholders are aware, as well as everybody within the health departments and within the government. We have a great example where a health department was going to be providing environmental health services for a neighboring jurisdiction, and they made an effort to make sure everyone in their local government understood that this was going to be happening, not just their public health staff. And that ended up paying off just because of the buzz that came up that was going around. And then when they added the other department's logo magnetically to some of their cars, people were not surprised to see that the other county's name was showing up, and it really helped facilitate things. So that, Travis, thank you for putting the link in the box. That is an overview of our factors that promote success, and the full document's available through the link.
So as Grace mentioned, really one of the key ingredients, so number 6 is all about trust. One of those key ingredients for any sharing arrangement to be successful. So to that end, I'm going to drop the link in the chat here as I'm speaking about it. The center developed this collaborative trust scale, and it's really intended to help current or potential sharing partners enhance relationships or overcome any barriers that may limit effective sharing. It can be used really at any point in the initiative, but typically, as Grace said, during that kind of partner and organizational building among team members to really get to know each other first. It is an Excel file that kind of calculates everything for you and gets into the what we call the 5 dimensions of trust, which include knowledge and skills, integrity, investment in community well-being, behavior, and communication. You'll see a screenshot here of the Excel document. If you go to that link, you can actually download it yourself. But the intent is for members of the collaborative would fill it out anonymously, and then it should only take about 10 minutes to complete. But then once you're done filling it out and you get a score, average scores for those 5 dimensions I mentioned will be automatically populated for you, and then you can really dive into examining and analyze how you're doing in those dimensions. Areas where there's low levels of trust should be identified and discussed, and then thought, and the group can think of ways to how to improve those areas. Excuse me. Using different trust building activities or structural changes to the actual group, or even to the process using for actually sharing those services. And then part of the link that I included, there's some additional like QI tools and techniques that can help facilitate all that. But yeah, I just want to nail the nail in the coffin, I guess, that trust, you really can't get started with anything without the trust of everyone involved. So feel free to take advantage of this tool and see where you guys are at as you're getting started, or even if you're in the process already. It's never a bad thing to assess where everyone is.
Number 5, you should know that your health department can keep all of its dollars focused on its own jurisdiction. One of the fears that health departments sometimes, and especially elected officials, sometimes have about sharing services is the concern that their taxpayer dollars will be used to support another jurisdiction. And we are here to tell you that that does not have to happen. In fact, it is very easy to make sure that doesn't happen. You can see on the slide here just 2 steps in terms of what it takes to make sure that costs are fair and equitable and the way that they ought to be. The first is to perform a full cost analysis, and the second is determine the best way to allocate those costs. Now, clearly there are some steps involved in each of these, and the link that's here on the slide is to a guide called Determining and Distributing Costs of Shared Services. So in terms of performing a full cost analysis, the piece that we always stress here is making sure that all overhead and indirect costs are calculated. We worked with a site where they didn't do that. They were very focused on the direct costs that were involved in sharing services, but they did not include all of their indirect costs. And fortunately, when it was time to renew the agreement, it was agreeable to raise the cost to account for those. But that's something, hopefully you can do right out of the gate. And then the second step here in terms of how to allocate the costs, you can see that there are 4 different ways that are listed here. And the way you do this, going back to the notion that form follows function, really depends on the service itself and the level of service that you anticipate in each jurisdiction that's participating in the shared arrangement. So you could do it on a per capita basis based on population alone. It could be per capita based on a segment of the population, be it geographic or age or some other factor. You could do it based on the prevalence of a certain condition. Certainly you could enter into fee-for-service arrangements, and then also weighted formulas. So weighted formulas really just means, and there are several different ways to do this, but you could take any number of factors that you wanted to consider and come up with a way to turn those into a formula and apply that to the costs and distribute the costs accordingly. This guide, I think, is particularly helpful to facilitate your thinking about the best way to do this. And even if you have a pretty good idea of what you think would be fair, it could be worth a glance just to make sure that you know what other options might exist out there besides the ones that you've been thinking about.
And following the theme of sharing guides and things that can help groups go through the process, number 4 on our list is a document called A Roadmap to Develop Shared Initiatives in Public Health, which, as I just said, can help guide you through the different phases of service sharing. So the roadmap itself, and let me put that in the chat for all of you. The roadmap itself is a tool that has a series of questions for groups to explore their different arrangements, and then has a link to resources. And if you've not seen this graphic before, I'll just briefly describe it. So there's the guide is broken into 3 phases. So phase 1 is really thinking about that conceptual feasibility of service sharing. So asking the question, will this work? Phase 2 is all about the actual operational feasibility of the arrangements. So how will this work? And then phase 3 is the implementation phase. So making sure you actually get to work. We do recommend that you do complete the phases sequentially. It's really important to start at phase 1, even if you've not used the roadmap before or potentially a little farther along. You can go back and kind of start at the beginning and work through the questions. We do have some examples of collaboratives that have really fallen apart if they, have not done 1 or 2 and think they're at the implement phase. So again, the link for the roadmap is in the chat, and feel free to explore that as well, and all the great resources that are part of it.
So number 3, and this of course speaks to one of the reasons that the Center for Sharing Public Health Services now is at PHAB, because sharing services can help prepare health departments to meet certain accreditation standards and measures. And I have up here a few examples, really just enough examples so the slide isn't too crowded, although we do have other examples that we could share. And the ones that are hyperlinked, we've written up those examples, and the other examples are examples that we know of, but we just do not have those written up. So you can see with the standard 1.1, we worked with a group that conducted a regional community health assessment and community health improvement plan. This involved 10 very rural counties, and the benefit to them of coming together and doing this as a group is that most of those counties would not have had any kind of assessment or plan at all. I think some of them had never had one before. So it was very advantageous to have one person who was getting data on all of them, especially when it came to the community health improvement plan, to understand where they could streamline efforts and really leverage available resources for that. Standard 2.1, surveillance. There are a lot of health departments out there that have little to no capacity when it comes to activities that are undertaken by an epidemiologist. And we have a couple of examples, and one of these is hyperlinked, of health departments that have done just that, decided to share an epidemiologist, and as a result, they've been able to look more closely at various conditions. So it's not only been a matter of being able to get their hands around certain communicable diseases, and this was pre-pandemic, but also then could be proactive in terms of looking at data and other ways to help them with their planning. Standard 2.2, emergency preparedness. We have an example, and this was in Nebraska, of a statewide MOU. Health departments across the state, and they've got a district system there, so it's fewer health departments than you might think. But even so, the health departments across the state got together and came up with an MOU so they could readily call on one another to assist in times of disasters. Now, this was pre-pandemic, and the example that they gave in terms of a reason that they wanted to do this is that, for example, if one county is hit by a tornado, it's likely that some of their neighbors have also been hit either by the same tornado or as part of the storm front. And so it's not reasonable to think that you can automatically get help from a neighbor when you're faced with certain natural disasters. And you might, in fact, need to get help from people much further away. And so that's why they came together and did this across the state. This is especially important because, and a lot of people face those kinds of weather-related phenomenon. It's because Nebraska is so rural, and because the health departments do serve multiple counties. It's that much, there's just not a lot of reserve. And so they just need to make sure that they have ready access to other health departments across the state. And it's a phenomenal MOU and a phenomenal effort. And then finally, health communications strategy. I had talked earlier about the health departments that work together to address a high rate of STDs. And something that was really interesting I thought about their effort was their communication plan around STDs and the need to get tested. That was a strategy that they came up with jointly and jointly implemented it. So another example there. So if as you are thinking about accreditation, we really encourage you to think about any standards and measures where you might not be where you want to be, where you need to be to become accredited, and think about sharing services to help you get there.
And really how all the work connects to what I do at PHAB and PHNCI is really harnessing the power of shared services as a tool for public health transformation, which is number 2 on our top 10 list. So I'm sure all of you have noticed that there's been historic funding levels available to provide opportunity to best ensure that everyone has sufficient governmental public health protection. And through the work that the center has done over the years, there's been a few examples in many states, but I'll highlight 3 states today that have really used grant funding and service sharing to help transform what's going on within their borders. So first we have Minnesota, who supported the creation of local sharing arrangements. There were 4 partnerships that were part of this project across the state, and they took on various activities like revamping their cost allocation structures, integrating programs with common policies, procedures, and ordinances across counties, and creating a regional community health improvement planning process with shared staffing models as part of that. In Washington, they redesigned their state-funded programs. Washington for a long time was looking at new service delivery models on how better to provide services in their state. And specifically, they were looking at the immunization program. They decided to offer it in 2 modes. One is what we call centralized, meaning the State Department of Health is processing all of their childhood vaccine orders throughout the state. But then they're also implementing a hub and spoke model, which really gives power to the local health jurisdictions to conduct site visits for compliance and also provide technical assistance for quality improvement across the state. And then lastly, we have Wisconsin, who transitioned to a Public Health 3.0 model. And there's a couple examples we have on the website that you can look into. But really looking at cross-jurisdictional sharing and other service sharing arrangements to help modernize their public health system and be more efficient and effective with neighboring counties in providing those services. And really acting as a chief health strategist and making sure that they're a leader in their state for transformation. And if when we do send the slides out, you can click on these links again and really dive into how they got started and kind of any challenges and any barriers they overcame and all the success that came out of their projects.
Okay, so this is where I really wish I had a drum roll. So the number 1 thing you should know is that the Center for Sharing Public Health Services at PHAB provides these various things that you see on the screen. Some of the examples, as I was saying before, some of the examples that I've talked about are written up, and those that are written up, you can find in our, it's called Cross-Jurisdictional Sharing, CJS in Action. On the website, there are about 15 stories there. We also have webinars on a variety of topics, not only the one that I mentioned about change management. We have a number of tools and guides that, that we have developed, not only the ones that we mentioned, but there are a few others on the website as well. We've collected several templates as well as several sample documents for formal agreements for sharing that can help serve as a basis, or at least maybe a kind of a beginning outline for you, anyone else who's interested in developing these. And then finally, we offer technical assistance to help you on your journey. And we encourage you to contact us, and you can see the email address there. In addition to Travis and myself, Wyatt Beckman from the Kansas Health Institute and Naomi Rich, who is at PHAB, are also on our team. So the four of us are here to help you, and we can help you in a number of ways. We can point you towards specific stories or specific resources that we think could be helpful for your work. We can help you understand how to use the tools that we have and describe tools that we haven't covered in the webinar. We can assist you with developing meeting agendas to get when you're getting your partners together, in terms of things to raise based on the roadmap, and also other examples of things, that are related to the work that you're doing to help you and to help facilitate your conversations in these meetings. We can put on a virtual webinar, or obviously virtual if it's a webinar anyway, or a small workshop, that kind of thing, to help lead your group through using a tool. I mean, there are just a number of different ways we can help you. So just because I haven't mentioned something you would be interested in doesn't mean we don't do it. Just please do feel free to contact us and let us know your thoughts on how we might be able to help you. Those are the top 10 things. And I will turn it back to Jessica for the Q&A.
Great. Thank you both so much. I particularly think all of the examples and all of the resources you shared are going to be super helpful, and part of our hope with the Center for Sharing Public Health Services merging into PHAB is that we can really continue to promote the visibility and all of the great things that we now have to offer to really engage more health departments and provide that technical assistance. So thank you both for so clearly laying that out and channeling our early aughts or 90s with the top 10 list. There have been a handful of questions that came in to us through the chat box, so I will run through them now. I'll do my best to paraphrase. One was really just speaking to the fact that, this all sounds pretty complicated. There are success factors and ingredients and trust and a lot of steps. And is there any kind of way to kind of boil it down or simplify or think about what might the first best step be if you're starting from scratch? Would be the first question.
Okay, it's a good observation. Depending on what you're seeking to do, it might not be complex or complicated so much as it might really require dedicated time. So I would really encourage you, kind of as a first step, to just take a deep breath, okay? And just understand that our work is really intended to help guide people through and make it simple as we can, and hopefully provide sort of a recipe book, if you will, for success. I think the very first thing I would do is take a look at the roadmap. Phase 1 of the roadmap in particular, that is focused on conceptual feasibility. I think it's helpful to sit down with your partners and go through the items that are in there to discuss them, because it really is intended to cover the things that you ought to be thinking about and talking about to lay the foundation for success. So I would say that's a starting point. And I would also say, absolutely feel free to email PHAB. And if you'd like to have a conversation about it, happy to have the conversation with you.
Fantastic. Thank you. So many
Actually,
years
Jessica,
of learning.
Could I add one thing really quick?
Of course.
Sorry. And just one thing to add, really recognizing that you are probably doing some of the things or steps already, just maybe in a different way or not as formalized. So similarly with accreditation, a lot of health departments were doing the work, they just weren't documenting it. So we feel that articulating how to do it in those phases and steps makes it clear. So yeah, again, just recognizing that you're probably doing it already, just maybe in a different way. And the guide and all the process steps can help you more formalize what you're doing.
Great addition. Thank you, Travis. Another question came in about the community. So you mentioned that there might be concerns among policymakers around, costs being shared and ensuring that one community's costs or budget is being dedicated to that community and how to overcome that. Do you have any experience where the community has raised concerns, or is this the sort of thing that the community either doesn't know about, doesn't care about, or generally gets behind and supports because perhaps it, increases or improves the services offered to them?
Nothing's coming to mind, but I invite my colleagues on the call to provide an example if you're remembering something that I'm not. I don't know if I'm just being overly optimistic or if we really haven't heard about pushback from the community. I think what I would say is that something that tends to be really important from the perspective of the community is their access to public health services. And so, for example, if a clinic location changes, it would be really, really important to make sure, well, first of all, that people understand that that is going to happen, but also to really think about whether or not a clinic, for example, needs to be moved. I think that's the kind of thing, when I think about the discussions that I've been privy to, I feel like that's the kind of thing that could cause some pushback. Yeah, I guess that's what I would say about that.
Sure.
And again, I invite my colleagues to chime in.
I would maybe just add that I imagine any of that would bubble up through the policymakers. And so maybe that's where it would come to bear. If in fact there was any pushback, right? You would go to your community, your county council, or you would go to your Board of Health or whomever the policymakers are in that community to complain, perhaps, if you were a resident. And so
it could be that. It also could be that that through a well-executed communication plan, where you are letting people know about the plan and what to expect, that in your own activities that could also come up. So it'd be very important to listen to that. Yeah,
absolutely. Those traditional community engagement activities of the health department. Thank you. The final question, I think, because we're just about running out of time, although if anyone has any additional, please chat them in quickly, is some of these things really just take time. So not just the dedicated time of the health department to kind of do some of the work, maybe writing an MOU or doing that, but building trust can't be rushed. If you don't have a prior collaboration and you need to have those personal introductions, those are all things that kind of need to happen and may take time to build. Are there any shortcuts? And I use that term not in a pejorative way, but are there any kind of time-saving ways to do these things? Or is it really just laying that strong foundation and taking the dedicated time to do that before really jumping in?
Yeah, I would say in my experience, this is not something that is well served by thinking about shortcuts. I think that that's not the place to think about where you can be super efficient with your time. I love the saying that work happens at the speed of trust. And it's hard won and easily lost. And I think probably most people on the call have heard that and understand that, but I would say you're really not ready to move forward and you don't have a good chance of success if you don't have a solid foundation of trust. So it's important to just be patient and understand that, because Otherwise, you run a very significant risk of moving forward and getting people around the table to nod and agree and whatever. But then things really fall apart when it comes time to implement.
Great. And so it sounds like some of this work, even if those on the line don't have anything in particular in mind right now, where they're looking to share a service at this moment in time, obviously being interested or looking to the future where these things might be relevant in their communities, it seems like there's no harm in starting to lay that groundwork now, because you never know when you're going to need it. And during the emergency is not the time, right, to have that first phone call to whether it's your neighbor close by or your neighbor far away, as in the example you provided. So never too soon to start. And as everybody heard today, so many resources available from the Center for Sharing Public Health Services that you can use on your own, or the availability of some level of individualized technical assistance. And all you have to do is visit the website or send an email and reach out and ask. So with that, I want to thank both Travis and Grace so much. And thank you all for joining today. And just a brief reminder, we're going to chat in a link right now. If you'd like to stay engaged in the conversation for 30 additional minutes, where we'll be face-to-face, we'll invite people to come off camera in more of a meeting style. And really any questions that you have, any kind of smaller group conversations that we want to have, we're going to use that time to explore in more detail. So please take a moment to copy and paste that Zoom link that Travis just chatted into the chat box. And in just a moment, we'll invite you to disconnect from this session and reconnect in the other session if you'd like to. For those of you that are unable to join us, please do complete the meeting evaluation. You'll be directed toward it as soon as we end this call. We really do use that feedback to improve future programming. And once again, just thank you all so much for joining us, and we will send the slides out to participants. So thank you so much. We'll see some of you in the next room, and the rest of you enjoy the rest of your afternoon. Take care.